So you come to me with pain and soreness after an injury, and you want to know why this is. First of all, there are two different types of inflammatory responses that the body can go through. There's what's called acute inflammation, which is how the body reacts to the injury and how the body kind of counteracts what the injury is doing to your body. And there's chronic inflammation, which is a continuous infection caused by bacteria and viruses. And this happens for a long period of time. The type of inflammation you have is acute, and we can recognize this by the 4 true cardinal signs that you present with. The area of the injury is warm and hot to the touch. There's visible redness surrounding the area. It's puffy and swollen, and you're in pain. So in addition to these symptoms, your injury happened a couple of days ago. It's not something that took months or years to get to this point. Okay. The whole inflammation process is a rather lengthy series of events that ultimately ends in the healing phase, where the tissue returns back to normal function prior to your injury. One of the first things that happens after you get injured is blood is going to rush straight into the site. Okay, you have blood vessels, which are going to get bigger and widen in response to the injury, and that allows for more blood and cells to get into the area. Okay, so normally within these vessels, you have special types of cells that are freely moving in the center, so they're kind of just floating along the center of the vessel. However, now that there's a disturbance going on that's messing up how they normally move during the inflammation process, these cells now are going to start moving and rolling on the inside of the vessel. So now that these cells are attracted to the edges of the blood vessel, so they're not anymore floating down the center. They kind of separated, and now they're kind of sticking to the sides and edges of the blood vessel. So as they move to the edges, they're going to recruit and gather up a lot more of their friends, and they are going to now be available to respond to the injury and do it more efficiently by gathering a lot more of other cells to help them out. Then, as they move along the edges of the inside, they're looking for a way out, kind of like a secret door or a passageway to escape out of. Eventually, they do see a little space that was caused by the widening of the blood vessel, and that allows these cells to leave and go into the tissue. Now that these special cells are out of the vessel and into the tissue, there's another type of cell that's waiting for them right outside, and is kind of like the line leader and is going to guide them into the injury. And this is very important, that there are a lot of these cells that gathered up inside of the vessel that left. So it's kind of like a mob of people that are going into the injured area, and you want this mob of cells so that they can respond to the injury and do it quicker and more efficiently. So one of the things that these cells have the ability to do is to hunt for their prey. Their prey being the infection in this case. Once these cells get into the infected site, they trap their prey and encircle it. Okay, and as they do this, they bring that foreign object into like a vacuum cleaner, and they kind of like suck it up and into this little vacuum cleaner that they made up inside of their cells. And these tiny components within the cell, they're going to start to destroy and eat what they've sucked in. Okay, so finally, after all of this happens, is when the injured area will start to heal. So depending on the amount and severity of death in the tissues is going to determine whether the healing process is going to go in one of 2 routes. The first way is that your cells have the ability to replace the lost and damaged cells with similar in structure and function of these old cells, so they regenerate. The second way is if the tissue is extremely damaged, the area won't be as lucky to be replaced by the same types of cells. However, instead, you have other components that come in and fill in the area of the damaged tissue, and instead of new cells, it will be replaced with scar tissue.